Well, Dr. Michelle Harkins is an expert in hantavirus from the University of New Mexico School of Medicine and says the particular strain of hantavirus on the cruise, the Andes virus, is the only one to have person-to-person transmission.
So the Andes virus is one of the 20 hantaviruses that may have infections in humans, but it is a very serious virus. Mortality with this virus is typically in the 30 to 40%, but if you develop more progressive disease with cardiopulmonary failure, mortality is over 50%.
Is there still a bit unknown about this virus? Because we know that some people might die, but others just might have very mild symptoms.
Yes, so it really depends on the host's immune system. So if I get the virus, for example, it may depend on what my immune system does to counteract the virus. So it's really related on the host being able to conquer the virus and not become quite as ill. So it can range from very mild symptoms to very severe symptoms and even ultimately death.
And is there any suggestion that there is human-to-human transmission?
So the Andes virus is the only known hantavirus that has been demonstrated to have person-to-person transmission. And it has occurred in Argentina as well as in Chile. There have been cases documented. It is suspicious that this is a person-to-person transmission of this virus.
So how then would you assess the risk to other passengers on the cruise ship?
Well, it's a little hard to assess for all of the passengers. This virus in particular is person-to-person with very close contact. So we don't know what all of the other passengers that contracted the virus, what their relation was to the original couple with the disease. But it is typically with very close intermittent or intimate, potentially, but very close interactions with an infected person. It is still very rare to contract hantavirus from person-to-person transmission, though.
What do you think would be happening behind the scenes with health authorities now? Because, you know, these people have been off the coast, not allowed off the ship. What would be going on behind the scenes?
Well, I think they're following what the World Health Organization is advising them to do currently, where patients would isolate or stay in their rooms. They would likely be working on opening ventilation and cleaning of the ship, and not dry cleaning, so not sweeping up things if they saw other items that needed to be cleaned, but they would want the patients to monitor their symptoms. And then if they had symptoms, to notify the crew on the boat. And then definitely isolate and wear a mask.
Do you think that these passengers should be let off? I mean, what does the risk pose to the community?
I don't think the risk to the community will be high. I think you always have to observe caution, however, and so if passengers are let off, wearing a mask and then having symptom evaluations constantly for several weeks would be appropriate. But I don't think that there is a huge risk to the general population by letting the passengers off the boat.
Dr. Michelle Harkins, it was really good of you to join me. Thank you.
Thank you so much.